Piroxicam is a nonsteroidal anti-inflammatory drug and SAID with analgesic, anti-inflammatory, and antipyretic properties. Its pharmacology involves several key mechanisms. 1. Cyclooxygenase COX inhibition. Piroxicam primarily works by inhibiting the activity of the enzyme COX, specifically COX-1 and COX-2. COX is responsible for producing prostaglandins, which are inflammatory mediators. By inhibiting COX, piroxicam reduces the production of prostaglandins, thereby decreasing pain, inflammation, and fever. 2. Anti-inflammatory effects. Piroxicam's ability to suppress prostaglandin production results in its anti-inflammatory effects, making it useful in conditions like arthritis. 3. Analgesic pain relief effects. By reducing prostaglandin levels, piroxicam helps alleviate pain associated with various conditions, including osteoarthritis and rheumatoid arthritis. 4. Antipyretic effects. Piroxicam can lower fever by acting on the hypothalamus, which controls body temperature regulation. 5. Long duration of action. One unique feature of piroxicam is its relatively long duration of action, allowing for once-daily dosing in some cases. 6. Absorption and metabolism. Piroxicam is well absorbed when taken orally, reaching peak plasma concentrations within a few hours. It is metabolized in the liver and excreted primarily through urine. The recommended dosage of piroxicam can vary depending on the condition being treated and individual patient factors. It's essential to follow your healthcare provider's prescription and guidance carefully. However, one can provide some general dosage information for piroxicam. 1. Osteoarthritis and rheumatoid arthritis. The typical starting dose for adults is 20 milligrams once daily. Some individuals may benefit from a lower initial dose, such as 10 milligrams once daily. 2. Acute pain and inflammation. The initial dose may be higher, such as 40 milligrams on the first day, followed by 20 milligrams on subsequent days. After the first day, the dose is often reduced to 20 milligrams once daily. Piroxicam, like other nonsteroidal anti-inflammatory drugs, NSAIDs, can cause a range of side effects. While not everyone will experience these side effects, some of the most common ones include 1. Gastrointestinal effects. Stomach irritation. Piroxicam can irritate the lining of the stomach, potentially leading to symptoms like abdominal pain, heartburn, indigestion, or nausea. Gastric ulcers. In some cases, NSAIDs like piroxicam can contribute to the development of gastric ulcers or bleeding in the stomach. 2. Cardiovascular effects. Piroxicam may slightly increase the risk of cardiovascular events, such as heart attack or stroke, particularly when used at high doses or for long periods. 3. Renal kidney effects. NSAIDs can affect kidney function, leading to fluid retention, increased blood pressure, and in rare cases, kidney dysfunction. 4. Central nervous system CNS effects. Some people may experience dizziness, headache, or nervousness when taking piroxicam. 5. Skin reactions. Skin rashes and hypersensitivity reactions can occur, although they are less common. 6. Gastrointestinal bleeding. While less common, NSAIDs like piroxicam can increase the risk of gastrointestinal bleeding, which can be serious and potentially life-threatening. 7. Hematologic blood effects. Piroxicam can rarely affect blood cell counts, leading to conditions like anemia or a decreased ability of the blood to clot. 8. Liver effects. Elevated liver enzymes have been reported in some individuals taking piroxicam, but severe liver damage is rare. 9. Allergic reactions. Allergic reactions to piroxicam are possible and can manifest as hives, itching, swelling, or difficulty breathing. 10. Fluid retention. Piroxicam may lead to fluid retention and swelling in some individuals. Piroxicam, like many other medications, can interact with other drugs and substances. Some of the most common interactions and potential consequences include 1. Other NSAIDs. Concurrent use of multiple NSAIDs, including piroxicam, can increase the risk of gastrointestinal bleeding, ulcers, and other side effects. It's generally advisable to avoid using multiple NSAIDs simultaneously. 2. Aspirin. Piroxicam can interfere with the antiplatelet effects of low-dose aspirin, which is often taken for heart health. If you're prescribed both piroxicam and aspirin, your healthcare provider will carefully manage the timing and dosages to minimize this interaction. 3. Anticoagulants, blood thinners. Combining piroxicam with blood-thinning medications like warfarin or heparin may increase the risk of bleeding. Regular monitoring of blood clotting parameters is essential if you take these drugs together. 4. Antiplatelet drugs, besides aspirin. Other antiplatelet medications like clopidogrel can interact with piroxicam, increasing the risk of bleeding. 5. Corticosteroids. Using piroxicam with corticosteroids e.g. prednisone can heighten the risk of gastrointestinal ulcers and bleeding. 6. Diuretics. Piroxicam can reduce the effectiveness of diuretics water pills and may affect blood pressure control, particularly in individuals with pre-existing hypertension. 7. Angiotensin-converting enzyme ACE inhibitors and angiotensin to receptor blockers ARBs. Piroxicam may reduce the effectiveness of these medications, which are commonly used for blood pressure control and heart conditions. 8. Selective serotonin reuptake inhibitors SSRIs. Combining piroxicam with SSRIs or serotonin norepinephrine reuptake inhibitors SNRIs can increase the risk of gastrointestinal bleeding. 9. Lithium. Piroxicam can increase lithium levels in the blood, potentially leading to lithium toxicity. Regular monitoring of lithium levels is crucial if you take both medications.